Hi everyone, this is Dr. Kusuma from Suria Plastic Surgery, Suria Cosmetic Surgery. I'm standing here on a beautiful Saturday morning in January because I wanted to showcase our brand new space that we just moved into late last year. We had our grand opening about a month ago. Many people came and they saw the space in person, and many patients we've seen since we opened here a few months ago. However, for those who haven't come here, I want to share this so that you get a good feel of what you're going to see when you come, and it's going to be easy transportation for you. So we are located in the city of Weston, Florida. It's a gorgeous city on the western suburbs of Fort Lauderdale. It's a very easy access actually. If you come from 75, you get off of Royal Palm Boulevard exit and then Weston Road, and we're right here. So about 5 minutes from the exit, so the transportation and mobilization here is rather easy. Plenty of spaces here. There's a motel right next door where out-of-town patients can stay literally a walking distance from here. There's all kinds of restaurants back here, literally walking distance from the office for those who want to eat when patients are having surgery. There's a bagel place across the street. Broward Health is across the street. And so it's an extraordinarily convenient space for people to be, and I'm very happy to be here myself. Okay, so this is the main entrance right here, right from the road right here. North Commerce Parkway is that road right here. And so once you enter in, you would come in here, and this is the office space you could see right across here. So this entire building, so this is our surgical entrance or exit when patients have surgery, but the main entrance you just saw earlier that I'll show you right there. All of this parking that you notice here is for patient parking right here. So it's very easy parking for patients to either park right in front of the building and take few steps to come inside, or overflow parking across right there. So very convenient space. All right, welcome in. So the first thing that should impress you, and it gives me a warm feeling every time I walk in this space, is this wall right here. This is Suria Cosmetic Surgery, Aesthetics and Med Spa. Okay, so this entire wall is a labor of love. My wife, my kids came on the weekends and evenings, and piece by piece they actually hand stitched this together, and this is a family affair for me and my family. We're extremely proud, and every time I come in here I feel so good being in this office space. The next part I want you to see is this room right here. This is the conference room. Lot of thinking happens here, lot of planning happens here, lot of meetings happen here where I meet with staff, I meet with software folks to design things. We have patient events here, educational seminars here. We shoot videos here for patient education. And this is a place where everybody feels like they can contribute and do great work. When you come out from here, this is how you would check in. You would come in and you would check in right at the front desk right here. And then once you check in and meet our staff, we would take you in right there. So now you're going to come into the inner sanctum. Okay, this is where all of the clinical and other aspects of work happen. So as you enter into this space, I want you to come down this way. This is our cosmetic coordinator's room. This is where Maria and Jane meet with patients, and they would take you in and discuss anything that you need to have discussed and take care of you. We also have the room for Gus, our massage therapist. So as I told you, and many of you know, we are a comprehensive, holistic space, office, surgical facility that takes care of the entire wellness spectrum. However, surgically we focus only on face and breast. Okay, so here Gus does medical massages, therapy, stretches, and things like that for many patients. For example, patients who have liposuction occasionally, they get lymphatic massages here. Patients who have facelifts and are stiff get their neck and back massage down the road, and so we provide that here as well. The next room over here is for our nurse practitioner. Here our nurse practitioner would do all kinds of treatments such as Botox injections, filler injections, hormone therapy, bioidentical hormone placement for patients, and talk about skincare and laser care and such. So this is the space where our nurse practitioner does her work. And so now if you go on this side, it becomes more clinical right here, this hallway. We we wanted to make sure that we represent our work very consistently and very, very well. For example, this is our photo room. This photo room is important because we want to make sure that all the photos we take have proper lighting, have the same consistent view, and so that the before and after pictures are as authentic as possible. Okay, so that's the photo room. When you come down here, conveniently the patient's restroom or bathrooms are right here for patients' use and staff use. But if you come down this way here, this room here is my procedure room. This procedure room is where I do all of my small procedures in the office. I also do Botox injections. I also do filler injections. This is where I see post-op patients after surgery, where I take care of their dressings and check on them and take out stitches and things like that, where my nurse helps me do that. And we do laser treatments and such here. So this is our procedure room. If you come across, again, every part of this is aesthetic. So you can see beautiful faces, beautiful figures, happy patients. This here is our consultation space. This is where I first meet and greet new patients that come in who want to discuss facelifts, who want to discuss rhinoplasty, who want to discuss breast surgery. This is where and how I would meet patients in our consultation space right here. Right next door, we do a lot of med spa services, aesthetic services. So this is our esthetician Caroline's space. She does all of our facial aesthetics work as an esthetician would. She does hydrofacials, regular Suria special facials. She does some skincare conversations. She also does radiofrequency microneedling services here. So here she comprehensively manages pre-op facelift patients, post-op facelift patients, and also general skincare patients as well, who require discussions about how to best manage their skin with skincare products and such. When you come out, here is our break room for the staff. You can see a beautiful, gorgeous view of the background here. This is South Florida for you. Beautiful palm trees everywhere. And back here, you can also see right across all of the restaurants right over there. The entire spectrum is full of restaurants. So people who have surgery, families waiting, they can go sit and hang out there and have something to eat and spend some time as their loved ones are having surgery done. Okay, so this is the back hallway. As you come down this way also, I'll show you. This is my office right here. It's an active space for me. This is where it's always messy because there's a lot going on, but this again is where I would sit and meet patients, meet staff, meet different vendors and different residents in teaching and things like that. And when I need to get away, I just need to turn my chair and I see the beautiful water and palm trees, and it kind of takes you away for a few moments in South Florida. So beautiful place to practice. If you come down this way, here we have our space or room for our permanent tattoo artist, Rebecca. She's been with me for nearly 8-9 years or so now, and she does weekly services for patients that include doing eyelids, doing eyebrows, lip tattooing, surgical tattooing. I myself got a tattoo the other day from her because she does such a good job. And so my first tattoo, by the way, in my life, I may get one or two more. But she uses this room, this space for all of her work. And if you come down here, as I told you guys, we try to think of wellness very holistically, right? So this is a room, you can see, a workout room. Why would a plastic surgeon have a workout space in a plastic surgery office? Well, because I already told you that this is about wellness, aesthetics, and the holistic way to look good and feel great all the time. It's no good if you're physically not fit and taking care of your body after you do great looking procedures, right? So here, Gus, our massage therapist, is also a trainer. He would take care of patients here and actually physically train them if need be. This is the backside entrance to the surgical suite. So what I showed you just now is our consultation space, where a lot of the consults happen, smaller procedures are done, things like that. This is where the big stuff happens. This is the big enchilada operating room suite right here. So if you come this way and pan out, I just want to give you a grand view. So this is this entire corridor from here to this side is all the surgical suite. Where I want to start with you is here, because like anything, you need great equipment, you need great tools, and you need a lot of supplies to do a lot of the surgical care that we do. So this is what is our place where we store our equipment. We do our sterilizations. We keep all of our tools here to use. And Tanya, our nurse, our scrub tech, who's been with me for now 12 years plus, has this is her home basically. So again, for her peace of mind, whenever she wants to, she has a great room to view. Here, the same background here with a great little pond. You know, you can see the other day some storks that came out here that seem to be mating, and the restaurant's there for people to just sit and hang out if their loved ones are having procedures done here. All right, so I showed you the main entrance right there, which is our Suria Plastic Surgery main entrance, but this is a side entrance essentially. This could be an entrance and exit for surgical patients. You know, you certainly can come from there, but this is how they would certainly exit, because it's very easy, because this is where the surgery is done. So come on this way. So if you pan out to the other side, that's where we started, right? So that's the main office. So it's all connected. It all feels nice and open and nice and transparent. So the general cosmetic patients would come from that side. The surgical patients can come from there, but they definitely exit from here. So this is a little sub-waiting space where their family can come sit and hang out here if they'd like to, while their loved ones are having procedures. Or as I showed you, they could go outside and go to restaurants, because there's plenty of them just within walking distance from here. Easy parking, easy access in and out. Okay, so this is our Suria Surgical Center, as we talked about right here. You would check in if you want to, or check out as needed right here, which is, you know, the surgical check-in check-out space right here, and then you would come in this way. This is the hallway that I already showed you for the main console space. So this is essentially can be cordoned off for the surgical center. This room right here is our pre-op room. I showed you our post-op room, I showed you the operating room, but this is where the patients would first walk in. This is where they would sit, and this is where they would change, and this is where they would get ready for surgery. So here is where the nurse would greet them, our surgical nurse. They would get their IV placed, they'll do their paperwork and whatever is needed, make sure that their photos are taken, make sure all the paperwork is signed, and all the medications are in place, all the instructions are given, so that the family can give them a kiss and, you know, leave the patients in our hands to be our responsibility during the procedure. This is our pre-op space. So this is the operating room right here. Even here we have beautiful access and views of outside if we need to, completely tinted windows so nobody outside can see anything. This is the place where I feel the most comfortable. This is where I do most of my work right here. This is a very special place for me, where I find the great satisfaction. The noise that you hear is because there's special ventilation here to make sure that the air that comes in is as filtered and as pure and as clean as possible, so we minimize contamination. So this is our operating suite. This is the post-op room, is where patients after surgery would come in and they would recuperate right in this chair right here. Okay, so this is a nice anti-gravity chair, extraordinarily comfortable. This can become a complete bed if needed, and you know, the bottom rolls up, and so patients are very comfortably recuperating here after surgery. After this is done, if they need any access to bathrooms, it's literally right next door within this room, so it's very convenient. So here we do anesthesia-based cases, which are basically IV anesthesia, and we do local anesthesia procedures as well, and we do many facelifts under local anesthesia. So literally after surgery, patients get up and walk out of here. So this is our office tour for you guys. I hope this is helpful for you to come to our office and feel at home even before you come here. So welcome aboard, guys. Thank you so much.